Hello all, welcome to PharmaNandan. This video is under the module Central Nervous System. Topic number 1, Antidepressants and Anxiolytics. This is part 2 video of topic number 1, Antidepressants and Anxiolytics. For part 1 video, refer to my channel. The second video in this Anxiolytics and Antidepressants is monoamine oxidase enzyme inhibitors. Before knowing this group of drugs, first discuss what are these monoamine oxidases. Okay, so what are monoamines first? What are monoamines? Monoamines are dopamine, norepinephrine, epinephrine, histamine, serotonin. These come under monoamines which are present endogenously in our body. Is there any other biologic amines, monoamines, which we can take through food? Yes, tyramine comes under monoamine. It comes through diet. What is the fate of these monoamines? These monoamines are metabolized by an enzyme oxidase. We call these enzyme as monoamine oxidase. What happens? These are converted to inactive substances, that is we call them as metabolites. So when monoamine oxidase inhibitors are given, these levels increase: dopamine, norepinephrine, epinephrine. Okay, and one more interesting point is, we know dopamine is the precursor of norepinephrine. Norepinephrine is the precursor of epinephrine. Okay, these MAO inhibitors are of again of two types. What are those? Monoamine oxidase type A and monoamine oxidase type B. What does this monoamine oxidase type A does? This acts on mainly on serotonin and norepinephrine. It acts on dopamine also, but less than compared to serotonin and norepinephrine. It converts to same inactive metabolites. And what is the other enzyme? Other type of monoamine oxidases? Monoamine oxidase type B. Okay. What does it does? It converts serotonin and dopamine mainly. Okay. Who acts on tyramine from the diet? Let us take tyramine. Tyramine. Tyramine in the diet, when we take it, enters GIT in the gut. Okay. After absorption, okay, it reaches liver. Okay. Who acts on this tyramine to convert into these inactive metabolites? MAO-A acts on the tyramine when it is present in gut and liver. MAO-A B acts on the tyramine when it is present in liver. Okay, what is the significance of this tyramine? Why are we discussing about this tyramine lot? We discuss in the slide side effects. Okay, let us know what are the MAO enzyme inhibitors, right? This monoamine oxidase enzyme, when inhibited, there will be increase in activity of dopamine, norepinephrine, epinephrine, histamine, and serotonin. Okay, so what else we know? Serotonin, when activity is increased, it acts as antidepressant. Norepinephrine activity, when increased, it acts as antidepressant. Okay, so monoamine oxidase inhibitors are used in the condition depression. So what are the monoamine oxidase inhibitors groups? There are two groups we can divide into. Let us divide into two groups. Okay. inhibitors of monoamine oxidase A. In this group, we will discuss inhibitors of monoamine oxidase B. Okay, what are those? First thing, inhibitors of monoamine oxidase A. Moclobemide and iprobemide. What are the inhibitors of MAO-B? Yes, MAO-B inhibitors are low dose selegiline, underline the word low dose. Low dose selegiline. Okay, is there any non-selective MAO inhibitor that is which act on both of them, MAO-A and MAO-B? Yes, there are. What are those? Same thing, selegiline when given in normal therapeutic doses. It acts as non-selective inhibitor of MAO enzymes, monoamine oxidase enzymes. What are the other drugs? Tranil, cypromin, and phenelzine, isocarboxazid. Okay, these four comes under non-selective monoamine oxidase inhibitors. Of them selegiline in therapeutic doses acts as non-selective. Selegiline in low doses acts as MAO-B inhibitor, specific MAO-B inhibitor. Okay. Again, is there any point like reversible or irreversible inhibitors? Yes, there is. Where is it? These are moclobemide and iprobemide comes under reversible, that is competitive inhibitors of monoamine oxidase A. Okay, then who are irreversible? Yes, this low dose selegiline and this non-selective monoamine oxidase inhibitors, all of them are irreversible. What does irreversible mean here? Yes, it takes around almost up to 2 weeks for the resynthesis of the all the exhausted monoamine oxidase enzymes. Okay, because they are irreversibly inhibited, so again new enzymes are to be synthesized. It takes 2 weeks. Okay, so within these 2 weeks there are no monoamine oxidase activity will be very low. Regarding this reversible and competitive, yes, there will be having one competition between these agents and the other agents. For example, I will give you an example of affinity. Let us speak in terms of affinity. Affinity of monoamine oxidase, A type of enzyme. What happens to it? What happens to its affinity? When we compare, the tyramine is having more affinity than these agents. So logically what happens when these agents are given, these agents and tyramine compete with each other to bind to monoamine A enzyme. Tyramine is having more affinity. So monoamine enzyme A is more bind to tyramine, so there will be less scope for this drug to act. So when there is less tyramine in the diet, then these drugs work better. Okay, when there is tyramine in the diet, these won't work well because this enzyme is bound to tyramine mainly. In the remaining enzyme part will be bound to these drugs. Understood? Okay, then where are these MAO inhibitors used clinically? Clinically, these are not used for depression nowadays because of side effects, but these are having a place in refractory depression. When any other, all other agents, when they don't work, then we will think of monoamine oxidase enzyme inhibitors in refractory cases of depression. Okay, then what are the side effects, why we are scared of these monoamine oxidase inhibitors? Let us discuss now. These are the side effect part. The first side effect is sexual dysfunction, usually associated with serotonin, and another side effect is there will be weight gain in the patient. The third side effect is we observed that as per statistics, the suicidal thoughts or suicidal behaviors in a patient who uses these monoamine oxidase inhibitor drugs, we have observed that their tendency is increasing, their thoughts are increasing, their behavior patterns are increasing with respect to suicide. Okay, another side effect is when these agents are given chronically for long term in a patient, we can expect serious side effect. Okay, the serious side effect maybe sometimes it might be life threatening also. What is it? Hepatotoxicity. And the last one, which is very important, is yes, cheese reaction. What is this cheese reaction? Cheese reaction is very important with respect to MAO inhibitors. What is cheese reaction? We can see cheese reaction when we give MAOA inhibitors to a patient and the same patient consumes food are highly rich in tyramine. We call them as tyramine rich foods. We can quote example as cheese. That's why we call it as cheese reaction. Okay, what happens here when monoamine oxidase inhibitors are given along with tyramine is also given? Tyramine is a natural food which is acting as a same monoamine, right? It is to be inhibited by MAO inhibitor, right? MAO agent, right? MAO enzyme, right? What happens when the enzyme is inhibited? There will be increase in the tyramine in the blood because no one is there to metabolize this tyramine, to inactivate this tyramine. Level increases in the serum. What happens when its level increases in serum? When reaching serum, it keeps on happily moving around the body, inside the body, till it reaches the nerve terminals. Which nerve terminals? Adrenergic nerve terminals. And they enter presynaptic nerve terminal. These adrenergic nerve terminals, okay, and enter into presynaptic region. Then what happens? After reaching this presynaptic nerve terminal, it stimulates the vesicles to release more and more, to release more and more catecholamines. What happens when these adrenergic catecholamines are released in excess? Yes, we can expect profound hypertension, which is very dangerous in this cheese reaction. Why it is dangerous? Because it might be life threatening. This is why we need to consider this cheese reaction, that is monoamine inhibitors plus tyramine when taken, it causes life threatening cheese reaction. Understood? So by now we completed MAO inhibitors. Okay, in the next part we will meet again with the part 3 of antidepressants and anxiolytics. This video comes under the module central nervous system and its pharmacology. Okay, There you can see a question. This is a true or false question. So if you know the answer, please feel free to put in the comment box. We can discuss for any queries. And thank you for watching. And if you feel this video is useful to you and it is helpful to you in understanding the concepts of pharmacology, please like the video and comment below your opinion and share this video to your friends, and don't forget to subscribe to this channel. Well, thank you. See you soon in next video. Thank you for watching.